Hello, and welcome to today's session. Today I'm going to be talking to you about the importance of having a women's health physiotherapy assessment post-birth and really optimizing your health and your rehabilitation of you and your body post your birth. Now, first of all, I want to recognize that this can be a really difficult time for you and certainly feeling quite disconnected with your body. So it's really important information that we're going to be going through today, but if you do feel at any point that you feel triggered, uncomfortable, I suggest going back to some of Kelly's grounding techniques, perhaps some of her breathing techniques, and just trying to give yourself the space and the time that you need, and come back to it as you can. So first of all, when you have experienced birth trauma, we can often feel quite a barrier to wanting to go back to see any healthcare professionals, to feeling touched. We can feel quite dissociated with that. And certainly any areas around our abdominal and our pelvic floor can be incredibly sensitive. And often we can start to dissociate from them. However, it's really important where possible that we can help ourselves to reconnect to that area of our body and to build trust with ourselves to then start to heal. So first of all, what is a women's health physiotherapist? Because sadly, I don't feel that it is actually recognised enough as to what women's health physiotherapists do and how we can help you in healing your body. So I am a women's health physiotherapist by background, and I really help women postpartum to heal their body. So what we are aiming to do is to first of all hear your story. So when you come in to see myself, I'm really keen to understand your experience and your story because that will make a big difference as to your recovery. So thinking what you have perhaps had pre this birth. Maybe you've had previous pregnancies and previous losses, baby losses. So it's really important for me to understand what your body's been through already, and then to understand about this specific birth in terms of how your labour went. So was it a vaginal delivery? Was it a C-section? Was it an emergency? Did you have any tears, episiotomy, and blood loss as well? How is your body physically healing and recovering post that birth trauma? So it's important that I look at your posture. I do, from my personal experience, I'm very much a musculoskeletal physio by background, so a lot of women's health physios are, and we will look at your posture and think about how you are moving, how your body, you're holding tension in your neck, your shoulders, your jaw, how you're breathing, which, often when we do experience trauma, we are often breathing quite shallow breathing. And this is really important because we could be holding a lot of tension in our jaw. You may be grinding your teeth. You may be holding neck and shoulder tension. So I will look to help you to relieve that tension as much as possible and identify it as well. It may be that if you're comfortable with it, we will use some hands-on approach and we may do some soft tissue massage and treatment mobilizations as we are assessing you as well. But we really will judge it on the person that's in front of us. We'll look at see how your diaphragm is working, so how your lower ribs and your diaphragm, which is right at the bottom of your lungs, how that is moving with your breath as well. And we may encourage you to take some nice deep lower thoracic expansion breaths to try and relax any tension in that diaphragm. We will then check to see if you've got something called a tummy gap. Now, I do talk about tummy gap in more detail in some of the other videos, but really we're looking to see what the tension is in the tissues. So in the diastasis recti, the tissues of the linea alba, which is the tissue between your abdominal muscles, and we will look to feel any tension there and feel how wide your abdominals are apart, and we will help and guide you how to safely engage your core so that you can bring that back together in a really safe and healthy way. If you have had a C-section, we will look at the C-section scar with you. And the most important thing when I'm seeing my patients is to really help encourage you to take away some of the lessons and some of the treatment techniques that I'm doing for you, and where you're comfortable, take them into your home so that you can do them for yourself, or if you feel more comfortable getting a partner to help you, then we can go through that as well. So once the external scar has healed and there's no signs of infections or redness, any swelling, any oozing, it's really important that that heals. And if you do notice any of those signs, then definitely go seek your healthcare professional's advice, just so that they can check that you haven't got any signs of infection of your tummy and your scar. But it's quite normal, if you've had a C-section, to feel numbness, even to feel quite a lot of pain there. Sometimes you can feel pain on the side that the surgeon was on, for example, or if your baby was stuck in any way, you can almost feel like it can still feel as if there's a sensation through your abdominal after that, postnatally as well. So we take the time to slowly assess you and to help your abdominal and your uterus area just to settle back down. And it may be that you will be offered any visceral massage, so like gentle tummy massage as well. Everything is specific to your needs, and you can consent to anything that you feel comfortable with, or decline anything you don't feel comfortable with. But as I show you in a lot of the practical videos, tummy massage is incredibly useful, not only for your digestion, but also to help heal scar tissue, to help that sort of ridge that you can sometimes feel above your scar. They call it like the C-section ledge sometimes, and we can help to soften that out. So a women's health physiotherapist can do it for you, and we encourage you to do it as much as you can yourself as well. We will look at your movement, your back movement, going forwards, backwards, side to side, rotations. We will look to see how your body is physically moving, and we'll also consider any past injuries, so any previous medical history or any injuries that you may have experienced in the past that may also be affecting you postpartum as well. So if you've experienced pelvic girdle pain during pregnancy, for example, we will help to assess how you're at now and give you gentle exercises that are specific to you to help to strengthen and heal your pelvis and your pelvic floor. So then moving on to your pelvic floor. If you are uncomfortable with it, I highly encourage that you have an assessment of your pelvic floor. And it may be that you don't do it the first session, maybe it's something that we can do over time. But when we assess your pelvic floor, we're looking for certain things. First of all, we're looking to see what the health of the tissues are like. You know, just like you can see a lot from the health of your skin on your face, and if you're dehydrated, if you're stressed, we can look and see what the health of those tissues are like. We can also have a look at to see whether you are activating your pelvic floor correctly. I think this is so important because there's no other part of our body that a professional would advise you to do an exercise for, close their eyes, turn their back, and expect you to deliver a great squat, for example. You would expect perhaps to have a little bit of guidance, maybe with some camera motion, or what's what I'm looking for, a mirror, or even some guidance with a hand. But certainly you would expect some feedback from a professional on what you are doing correctly or not, based on what their assessment of what they can see. Well, when we do pelvic floor exercises, often we are told how to do them, but the valuable feedback that you can get by somebody actually checking to seeing if you're doing it right is incredible. And so we encourage you to activate your pelvic floor and then relax it. We can also see if you are tight in any areas, because it's a common misconception that postpartum we're often weak, but sometimes we can actually be tight, particularly if we're holding a lot of stress and tension in our bodies. And if you've experienced any trauma, it's likely that you are holding that fear and tension in your pelvic floor. And that could be causing you pain, could be causing you discomfort of any sort. So we will identify what's unique for yourself, and we will help you to release that. And that may be with relaxation techniques, breathing, maybe with gentle stretching, and it may be with manual therapy or massage. If you've experienced any tears or episiotomy, you may be referred to an NHS physiotherapist if you've received a significant tear of what we would consider grade 3 or 4. But lots of women experience tears and grazes in their pelvic floor area, and they don't necessarily have any follow-on treatment. They may get their doctor say, yes, the stitches have healed well, there's no concerns. But you can be left with scar tissue just like anywhere else in your body. It can get tighter and tense, and this may cause you discomfort, when you're trying to release your bladder or your bowels or on sexual intercourse. And so it's really important to help to soften that scar, just like we do with a C-section scar or any other scar in your body. Gentle massage can help to release it, gentle stretching, breathing exercises, etc. So I think that I have covered the majority of what pelvic floor assessment is all about, and thinking more widely about what we would do in a women's health, what I would do specifically in a women's health and mummy MOT assessment. And I think it's important for you to feel empowered to request a physiotherapy appointment if you really feel that actually you have got any concerns with bladder leaking, problems with releasing your bowels. Maybe you're constipated and you're struggling to get fully able to release your bowels. Perhaps you've got concerns with scar tissue or pain in any area of there. If you can, ask your GP for a women's health NHS referral if you are based in the UK. Otherwise, there are other private practitioners that you can seek help from, may that be a mummy MOT practitioner or a women's health physiotherapist. I'm going to pop a few links below for some search engines that you may be able to find somebody that's local to yourself. I really hope that has helped. Just identify what a women's health assessment is and why it's so important for you to have one, so that you can gain the safe, evidence-based exercises that are going to ensure that you not only have the rehabilitation that you need, but also the hands-on therapeutic treatment that you need to optimize your postnatal health. There's so much more that we cover, but this is really just a little taster as to why you might find it's super helpful and important to have a women's health physiotherapy assessment postnatal. And if you aren't able to, then please do keep watching these videos, because a lot of what I go through in my women's health assessments and a lot of the treatment techniques that I give my women, I am deliberately putting in here for you so that you've got the resources at home as well. Thank you so much for watching. As always, please do leave a comment if you've got any questions or concerns, or if you found this useful, let another mum know by popping a comment below, and we hope to hear from you soon. Take a deep breath. That's for me as well as you. That was a lot, but I hope it was helpful. And if you've got any questions, please don't hesitate to contact us. All right, bye everyone.